Welcome everyone. We'll get started in just a few minutes. We thank you for coming. You will be on mute for the entire duration of the event, but we'd like to remind you that if you put your questions in the comments, we are looking for them. So we'll get started exactly at 4 o'clock. Thank you for coming, everyone. We'll get started in just a few minutes. Thank you, everyone, for joining us. We'll get started exactly at 4 o'clock. I would like to remind you to go ahead and put any questions you have in the chat functions so that we can get them in and have our panel respond to your questions. Thank you. Thank you for joining, everyone. We are here to talk about jobs in the time of COVID. We welcome you today and hope that you are entirely well and that you are able to contribute some fantastic questions to our wonderful discussion today. So first, I'd like to welcome you. We have people joining us today on Zoom, Facebook Live, and YouTube. Everyone on Zoom except for the speakers will be muted for this event. But don't worry, if you are on Zoom, you can ask questions by typing into the chat box. And if you're on Facebook Live, you can enter the questions into the comment section. Don't worry, we'll go through them and try to get your questions answered. If we do not respond to your questions online, we will get to them afterwards. Also, please be aware that the Facebook Live video feed is a minute or two behind the Zoom feed, but we will be able to get to you and we'll make sure that we get all the answers. Now I'm going to get started by introducing our panel. Ms. Lavertu is a mother, a small businesswoman, and chair of the Spring Valley Community Planning Group. She has been an active volunteer in her community for over 20 years. Liz is running for state assembly in the 71st Assembly District, advocating for the economy, for education, and she wants to be your next assembly speaker, your next assemblywoman. Sorry, I lost my train. Yeah. Our next speaker will be Kate Schwartz. Kate Schwartz has served as a licensed behavioral care professional for over 3 decades and serves as a director of the Fallbrook Regional Healthcare District. She has spent her career advocating for healthcare patients and their families and has provided behavioral health care services in both the public and private sectors. Kate Schwartz is a Democratic nominee for California State Assembly in the 75th Assembly District. Leo Mamara is a history professor who comes from a working class family background. 4 generations of his family have worked with unions, including ILWU and SEIU, and Liam is a past and present member of several unions, having worked as a longshoreman, a fry cook, and a computer nerd. He later finished his PhD and has taught college for 12 years, where he focuses on the history of ideas, including public policy and economics. Liam is the Democratic nominee for U.S. Congress in the 42nd Congressional District. So now to start our discussion on jobs, we're going to get started with Liz Lavertu. Hi, Liz. Can you share with us your experience with employment in this environment? Can you share?
Yeah, definitely. Thank you. Liz Lavertu, running for state assembly in the 71st Assembly District, which is East County, San Diego, and parts of Riverside County. I am here today to let you know you're not alone. I, like 26 million other U.S. residents, have been left without income during the pandemic. I was furloughed from my job since it was non-essential. In California, we're getting close to about 4 million people who have requested unemployment benefits. Now, requesting unemployment benefits and getting them are 2 different things. We've definitely learned, California quadrupled the number of people requesting unemployment benefits, and it's reaching about 17% of the California workforce right now as being unessential or non-essential during this time. So I applied for benefits like many Californians did about a little over a month ago. And so far I have certified for 4 weeks of benefits, but still have not received any money or benefits from unemployment. Our system wasn't built to handle this type of requests. And so, there are things that are going into place to help us out more. I filed a little bit before there was problems with the online system, but the online system has been backed up and it's up and running pretty good now, where you can access the information online. And then Governor Newsom did, we used to have Monday through Friday, 8 a.m. till noon was the call times for the EDD, for the unemployment, but he's expanded it now. So that's good. So it's 8 a.m. to 8 p.m. every day, 7 days a week. And a lot of people are having success with getting through to answer the important questions, because for a lot of us, this is the first time, we've been in a situation where we've needed, assistance from the state or from the government. And, we're finding ourselves in these new uncharted territories and are a little bit confused about the process. So the great thing is that there are a lot of like online resources for you to look at to see, how you can qualify for them. And then coming up in, oh gosh, when is it? It's on Tuesday, which is what, the 20, I forget it. Tuesday, whatever Tuesday is. I don't know. All the days blend together. We all know that we're in quarantine. Days of the week don't exist anymore. But on Tuesday, if you are an independent contractor or self-employed, you will be able to go through the system and apply for benefits as well, which typically you are not qualified for. And with the CARES Act, my mom too, actually, oddly enough, is in the same situation. She's furloughed. She's a dental hygienist, and we have to save the PPE for the emergency and the coronavirus patients. So she's also unemployed. But the great thing is for her, because she got her debit card already, and they've loaded money in twice now, and she's getting the other $600 from the CARES Act for the national level too, which a lot of people are asking, like, how do I get that extra 600? Where do I apply? You don't actually apply anywhere. It just is automatic when you apply for your EDD benefits. That is something that they put you in as well. So there are some good stories out there with people, getting the financial support that they need, but still, it's a very difficult time. And so if you do have questions, it's a good time to call, since they're open 7 days a week from 8 a.m. to 8 p.m. now. And I'll post that phone number in the chat when I'm done. But when we, I guess we're really lucky that we live in California, being the 5th largest economy in the world, and who knows what that even looks like now with the economy the way that it is. But, looking, at different research and numbers, economists are thinking that most likely by the end of 2021, yes, I said 2021, at the end of 2021, our unemployment rate will probably be just under 10%, which is still very high as a nation for unemployment. So with California, we have the opportunity to, put in some very strong legislation to make sure that our numbers for unemployment drop faster than the nation's levels, and make sure we can get more Californians back to work and have a strong economy again. So different things that we need to be looking at as a state. One of them is, we need to look at how can we create new jobs right now. A lot of people, especially in the service industry, when we're able to come out of this, might not have a job to go back to, and a lot of companies most likely will be downsizing because of spending habits. So we really need to focus on what areas do we want to grow, where are our benefits as a state. And I believe that investing now in green and renewable energy, creating more jobs and doing paid job training for those people who have been displaced, due to COVID, is a good start. And then also on top of that, in my district, and I'm sure there's other districts throughout the state of California too, we need more behavior and mental health facilities in our area so we can create some good paying jobs and bring the resources that we need to our community right now. I mean, this is really the time for California to invest in where our values lie. And I believe those two places are places that I would like our district to look at as far as investment goes. And then I just wanted to give you guys a quick other little note. So I'm going to put in the chat a link for those who are like self-employed, where you can get the unemployment information and assistance. And then also just facts about coronavirus and what different types of resources are available. So I will put that in the chat when we're off, and I look forward, there's lots of great questions coming through. I look forward to talking to you about those questions later. Thank you.
So just a reminder to everybody, these great resources that are coming through, we will be sending them out. We'll put them all together later on. So if you're not in the Zoom call itself, you will get them later on. We'll put them on the Facebook, you get them by email. So do not worry, you're gonna get all of these great resources. Next, we're gonna go to Kate Schwartz. Hi, Kate, how are you doing today? Oh, we have to unmute.
Got it.
There you go.
All right.
Okay, so
hello, everyone. Yes, and thanks for joining us today for Inland District's Town Hall to discuss jobs and the economy in light of COVID-19. My name is Kate Schwartz, and I currently serve as a local elected trustee on the Fallbrook Regional Health District Board. We've been working very hard to support our local communities during the COVID-19 crisis. I'm also currently a candidate for Assembly District 75, and you can visit my website at kateforassembly2020.com to learn more about my platform on healthcare, housing, highways, and habitat. In addition to being a licensed behavioral healthcare provider for 3.5 decades, I also have been and continue to be a small business owner for over 30 years. As challenging as this pandemic continues to be, isn't it great to be in California? That's definitely one of the silver linings. And doesn't this public health crisis highlight just how important your state government truly is and how important your vote for your state representatives are? In terms of the current economy, the League of California Cities is currently projecting staggering losses to all California city budgets, both within this fiscal year and the next, as a result of severe loss of revenue sources and unanticipated COVID-19 expenses. Individual businesses, particularly our small business communities, our Main Street shops, are fearful of closing their doors permanently if the losses are irreparable. However, other researchers in the economics field believe the economic predictions to be overly negative and dire, and just as we are managing our public health crisis, we also may be able to bounce back quite well from the temporary halt in our economic activity. Researchers from Los Angeles point out that the current pullback from health emergency mandates is not the same or near as dire as a shattering recession from a financial bubble bursting. They state, as COVID-19 mitigation measures are relaxed, the economy will likely bounce back in the third and fourth quarters. They also note that just prior to COVID-19 emergency, the labor market was suffering from a shortage of workers. So they state that the second quarter will definitely post record negatives. However, that will be followed possibly by record positives in the last half of the year. They note that the vast infusions of financial relief from the federal and state government, over $2 trillion, have been offsetting many of the ills that might otherwise grip the economy. And researchers reason that household savings has been far better during this emergency than during the 2008-2009 financial collapse, positioning consumers to better weather the downturn tied to the federal and state mandates. Unless, of course, we have a resurgence of COVID-19. So we are back to prioritizing our public health. And let me speak for a moment about some of the most recent new programs and policies to address the very challenging impact of a pandemic on our economy and jobs. What is our state and our county government doing and proposing to do to relieve the fiscal crisis? As we all know, on April 2nd, Governor Newsom announced the support for California's small businesses. He noted they are the backbone of our state economy and the heart of communities and main streets across California. He also instituted a new portal to connect Californians to job opportunities, which is onwardca.org. The San Diego County Board of Supervisors voted unanimously this past Tuesday to approve a $5 million loan program to help small businesses in the unincorporated areas that have suffered losses because of COVID-19. And this program will be overseen by the San Diego Foundation. The loans are intended to allow these businesses to stay afloat and to recover quickly once the state's stay-at-home health order is lifted. And you can find out more information at business.ca.gov/coronavirus 2019. The state of California is also allocating $50 million to the Small Business Finance Center at California's iBank to mitigate barriers to capital for those small businesses. And these are the businesses that may not qualify for the federal funds, including businesses in low wealth and immigrant communities. And the $50 million allocation will recapitalize the iBank Small Business Loan Guarantee Program. We also have in the state the Disaster Relief Loan Guarantee Program for small businesses. And you can go to the Governor's Office of Business and Economic Development, GoBiz, and that is under business.ca.gov to learn more about the business and economic development programs under the state. Some new programs for unemployment include the Pandemic Unemployment Assistance, and that is for those who do not qualify for traditional unemployment benefits, such as business owners without employees, those self-employed, and independent contractors. In addition, this week, we all heard that the federal programs for the U.S. Small Business Administration have been refunded, such as the Paycheck Protection Program, the EIDL, and the Small Business Debt Relief. And I'm sure that Dr. Romero will be speaking to some of that. I would like to make a note about assistance for mortgages. The Federal CARES Act gives borrowers of federally backed loans the right to contact the mortgage loan servicer and demand what's called a forbearance. And in other words, skipping their mortgage payments by attesting that the coronavirus crisis has resulted in financial hardship. And lenders can authorize forbearance up to 90 days at a time. Now, many consumers were concerned about this because they heard that the only option for repayment was a lump sum at the conclusion of the forbearance, which of course helps no one. In fact, effective July 1st, as part of the CARES Act, in addition to forbearance, consumers will be able to apply for an actual deferment for their mortgages. And that can last, well, the deferments can go up to 1 year. And what they would do is establish repayment for the conclusion of the loan. In that way, there would be no hardship on the borrower and no out-of-pocket expense. What would I say about lessons learned that would have prevented or lessened this pandemic and the economic crisis? Of course, we would start with maintaining federal and state emergency preparedness teams and stockpiles. In Sacramento, I would promote new legislation that state emergency preparedness programs would never be eligible for state cutbacks or defunding, regardless of budget considerations. Our prior health surge capacity initiative, set up by Governor Schwartz in 2006, was defunded in 2011 due to the recession of 2008-2009. I would also work with our congressional representatives to return medical and pharmaceutical manufacturing back to the U.S., and specifically to our state, where our biotech industry is already well established and would be prepared to begin those manufacturing processes. In Sacramento, I would also demand healthcare for all Californians, affordable and accessible, as we are only as healthy as the person standing next to us. And a public option and singular healthcare system, a not-for-profit system dedicated to the public health and well prepared to respond to California Department of Public Health and the CDC during an emergency. In Sacramento, I would promote sufficient sick leave for all workers, allowing them to return home to get well and also to protect public health. I would also promote living wages, unions, and affordable housing to end California workers living paycheck to paycheck and one emergency away from financial disaster. In Sacramento, I would promote humane animal treatment, punish animal exploitation, and work with our global partners to end live animal markets, often tied to these pandemics. I currently object to the recent discussion of retrofitting or pandemic proofing our universities, ballparks, public venues, and sidewalks. I believe this would be far too expensive in infrastructure costs, rather than responsibly managing our public health crisis. And we need to prepare for more remote work instead. Creating a remote work task force of economic development organizations and private sector leaders, especially smaller businesses, and providing access to resources for attracting and managing a remote workforce with a focus on building social and civic connectivity, I believe is the key. Obviously convening telecommunication providers to improve broadband strength and capabilities through our regional communities, particularly those on the outer edge or in rural settings. And we need to ensure that Main Street survives. All of our small shops, restaurants, bars, and other mom and pop shops that create jobs and lend the character to our cities are at severe economic risk right now. Some projections suggest that as many as 3/4 of them may not survive the current crisis. The loss of our Main Street businesses would be irreparable, and not just for the people whose livelihood depend on them, but for our cities and communities as a whole. The places that have protected their main streets will have a decisive competitive advantage as we return to normalcy. So loan programs from government foundations and the private sector, as well as from support from small business and technical organizations would be necessary and essential. And what will preparation for the post-pandemic recovery world look like? Where might the silver linings lie? We have the opportunity during this pandemic to reflect on the many positive changes in our lives forced upon us by external circumstances. One community member put it this way: I can effectively manage my work at home, be an effective and present parent, and I have a life again. There is a lot to be said for all of us not rushing out every morning to stress out in traffic congestion, saving money on commute expenses, auto insurance, and maintenance, and having the time instead to cook nutritious home-cooked meals, enjoy them with our families, and have the time to get out and exercise daily. I can see how this would save our health and society healthcare expense as well. Not to mention saving wear and tear on our transportation infrastructure, aligning with our climate goals, and with the availability of technology, creating a more humane way of living. And while spending more time within our communities, we would be around to support our local businesses, use our local farm fresh produce, shop at our mom and pop shops, and could order online or go outside the locality for items that could not be purchased locally. Could we be happier and more productive? Yes. And would it not be a win-win for business? Yes, it would change the infrastructure and daily routines for business, and new creative ways for conducting business utilizing technology could also significantly reduce costs for businesses and improve their bottom line. Perhaps reimbursements to staff for out-of-town meetings and conferences would be less frequent. And with employees working from home regularly, expensive business overhead and infrastructure could be reduced. Less need for many industries to utilize large buildings for office space, parking, administrative costs. And what could we repurpose the unnecessary office space for? How about affordable housing units? There is an opportunity in every crisis. This may be our chance to recreate a more humane and prosperous world, for us to all work more effectively, be present with our loved ones, and have a life again. It's up to us to rise to this new challenge. Thank you.
Thank you so much, Kate, for all of your incredibly great and important thoughts. Now we're going to hear from our final panelist that's joining us, Leo Marmara. What are your thoughts on the current situation related to jobs and COVID?
So, let's see, I'm muted. Okay, cool. Hello again, Liam O'Mara, candidate for Congress, CA 42. Some of us have heard the gist of the bills passed by Congress to tackle coronavirus, but I'm going to run through a few elements of them here and then turn to what wasn't done and should have been done. The first smallish bill, only $8.3 billion, put all its funding toward combating the pandemic and included transparency and accountability provisions in the text. Pretty good so far, right? The second bill included some genuinely good ideas that should have been in place all the time. For example, it guaranteed free coronavirus testing, which would be the case anyway if we had proper universal health care. And it increased Medicaid funding, which has definitely helped some states battling big outbreaks. But its most touted provisions have severe flaws. First, it did grant paid sick leave to many more workers, but that being necessary at all is nuts. No other rich country lacks a nationwide requirement for paid leave. As a result, more than a quarter of the US labor force before the pandemic had no time off for illnesses. And the requirement in the bill included a huge loophole exempting companies with 500 or more employees. This includes some whopping big companies that still aren't offering it, like Burger King, Marriott Hotels, Applebee's, Dunkin' Donuts, Holiday Inn, in case you're interested in some kind of ethical consumption maybe. A few big ones that don't normally do it, like McDonald's and Walmart, have announced they will offer it during the pandemic only. But as they're not required to, we've already seen major issues in their implementation, and a lot of their workers are still uncovered. Now, next, the bill enhanced unemployment benefits, which came up a little bit in the earlier discussions here. And that's a situation that, well, some Republicans have bitched about ever since, arguing that if you get paid well enough through unemployment, you'll just quit your job and take it. Folks, if getting $2,000 in unemployment is an incentive to quit, that's an argument for fixing our absurdly low wages in this country, not for letting people lose their homes, as Lindsey Graham would prefer. Okay, so the third bill is a whopper, a full $2 trillion in spending, but not as much of that gets to where it's needed as you might hope. $500 billion was earmarked for large corporations outright, and another $377 billion for small businesses, but with much of that latter cash actually taken by large corporations. We don't have precise numbers since the GOP refused stringent oversight on how the money was dispersed. And what little oversight was actually put in the bill, Trump announced as he was signing it that he would simply ignore. As you might have guessed, all those conservatives who love to scream about the Constitution were silent as the president refused his oath to execute laws duly passed. And of course, the incumbent in my district voted against any oversight for spending, which is hardly surprising given his history with pork. $154 billion was earmarked for direct public health spending, great, and another $340 billion for aid to the states, but that's something Trump has also threatened to play politics with, arguing for a right to withhold aid to the states whose governors are not sufficiently fawning in their praise of him. The biggest single part of that CARES Act was the $560 billion set aside for individual support. The lion's share of that is a one-time cash payment of $1,200 for individuals and $500 for each dependent child. Sounds nice, right? But in the richest country on earth, how is this payment so much stingier than that of many other rich countries that are less hard hit by coronavirus? And why is this payment going to so many people who don't actually need it? It's also a one-time check rather than the support throughout the emergency promised in so many other places. Now, I could pivot from there to a discussion of what should have been done, except for the newest piece of legislation just passed yesterday, which was a $484 billion expansion of the small business loan program from the prior CARES Act. That the original $377 billion was gone in 1 month, despite countless businesses struggling even to get applications approved, is doubtless due to graft. And freed of any oversight, the administration could simply funnel cash to friendly businesses. But whatever, I mean, like, don't expect Republicans to complain about this socialism for the rich, as it's sometimes called, as they're always happy to raid the till and rack up debt when they're guys in the White House. One peculiar irony in the poor implementation of this policy above is that keeping workers paid and employed is literally in the title of the $2 trillion bill passed at the end of March. Would that it were in the bill's power to do so. Alas, so little cash was allocated to the task and so little oversight offered for implementation that we have already shot to an estimated 18% unemployment. I'm going to pause and repeat that figure because I think it's important. We'll have full numbers in a couple of weeks once Department of Labor finishes their number crunching and releases their regular report. But analysis published by economic watchdogs as conservative as Forbes have it at 18% already. And keep in mind that peak unemployment during the Great Depression was 25%. We have seen nothing like this since those awful days, and the consequences of that will be long with us. Now, from here, I'd like to make a few points about what should have been done and connect those to permanent policies that I'd like to see, which would make responding to these things much easier in future. Because after all, there are many reasons for the US getting a bad case of this coronavirus that are completely outside of our hands, including being a top economy and major transit point. But there are also many ways in which uniquely American choices have made things worse and helped to make us the global epicenter of this disease. So let's start with healthcare. Seems reasonable. Why is it that prior to the pandemic and the layoffs, 28 million already had no health insurance? Why also did tens of millions more have, frankly, shitty plans with high deductibles and copays? This is an obvious factor in our being the 35th healthiest population in the world. One problem with our approach to healthcare lies in tying it to employment. No other rich country has a healthcare system dominated by employer-provided benefits. But of course, no other developed country lacks a public system of universal healthcare in some form or other. This has a wide range of negative consequences for the economy, from suppressing innovation and entrepreneurship to limiting movement across the country for new opportunities to the astonishing waste for which our system is rightly mocked. Corporate insurance involves administrative costs between 20 and 30%, while Medicare operates at a mere 2%. That kind of efficiency ought to be celebrated, but of course, it's a threat to Republicans' anti-government orthodoxy. So the far lower cost of Medicare is concealed, and they scream and cry that Medicare would raise the national debt. This is transparent nonsense, given that better coverage can be provided to all Americans and still cost far less than we're currently spending. And in a pandemic situation, our approach is even more incredibly irresponsible than ever. Millions of Americans have already lost their health insurance due to the spike in unemployment. Not all of those will be able to afford the COBRA system or qualify for a state-run low-income system. So we now have a whole lot more people with no coverage at a time when we most need to keep people healthy and strong. You know how many other people have lost health insurance in a developed world due to COVID-19? Zero, nada, zip, squat, zilch. Another area in which our policies have been lacking in relation to the rest of the rich world is in those unemployment statistics I mentioned earlier. You know, where unemployment's reached 18%. The IFO Institute in Munich expects the coronavirus to increase German unemployment by somewhere between 0.2% and 0.5%. And that's starting from February numbers of 3.2% unemployment, which was lower than ours before the pandemic. And apparently it's not about to change very much. Meanwhile, as early as a month ago, JP Morgan Chase was estimating US unemployment could reach 20%. That figure could end up being surpassed if we don't get things under control, because we're already almost there in 1 month of lockdown. And this unemployment is a choice being made in Washington, D.C., and it is one that Western Europe is not making. These layoffs will force an expensive rehiring and retraining once things have calmed down, and that's money U.S. businesses should not have to spend. Rather than let people lose their jobs and their health care in the US, we could have used direct wage subsidies, whereby the state takes over payroll for a time. That makes it easier for business to weather the quarantine, since payroll is generally the largest single expense. The spike in the unemployed will inevitably have other negative impacts, notably on consumption. And here's where we can see so clearly one key fact about the economy that the right tries so hard to deny. Workers create most of our wealth, not stock markets or investors, and they do so mainly through consumption. The decline in wages over the last 40 years shows that one of the biggest lessons of the Great Depression have been forgotten. The short history lesson here, remember my profession, I'm gonna keep quiet, is that in the 1920s, the US became the first economy to transition from a capital goods basis to a consumer goods basis. But since pay did not rise for most workers during that decade, when the market crashed, there was very little liquidity in the hands of most households to sustain spending and thus keep the businesses purring along. If a person cannot afford to buy a new toaster, the manufacturer has to make fewer toasters. So he let some staff go. Those unemployed folk, in turn, cannot afford toasters, and so he sells even fewer and has to let more people go. Next thing you know, whole industries have collapsed because the working class had no disposable income. Henry Ford had a great insight well before the Depression that if he paid his workers better, they could afford to buy his products, and he would sell more. After World War II, this Fordist approach became the norm, with wages rising along with productivity and creating our middle class. The shift to consumption as the economic engine is one of the best arguments, actually, a side point, for a basic income. If people have a guaranteed bottom floor in income no matter what, more people are able directly to contribute to the economy, boosting growth overall. Congressmember Ro Khanna has already introduced a $2,000 a month stimulus check for everyone making less than $130,000 annually, which is a far better idea for sustaining our economy and keeping up spending than a one-time $1,200 that we got. The other argument for a basic income, of course, is that it would wipe out poverty. I mean, give people a start that they can build on, steadily increasing their economic activity, building a nest egg, rather than just doggy paddling to stay above our bills as so many of us do. The policy was mentioned a lot in the 60s and could have finished off Johnson's war on poverty if Nixon had gone with it, as he was originally considering. But then came the tax-cutting anti-government orthodoxy of the Chicago School, and then first under Nixon and then Reagan, all our progress against poverty fell apart. Side point. I'll end, though, with a few quick policies, very briefly, that we absolutely should have in place so that we can better manage an emergency like this in future, right? First, restore the ability of workers at all levels easily to organize and unionize, as so many at e.g. Amazon and Walmart would like. This will help reverse a decline in wages and make the US economy as a whole much stronger. Second, let's decouple healthcare from employment at last by passing Medicare for all. This would allow people to change jobs, to start their own businesses without losing coverage. It would save us a ton of money. It would make the country healthier. Third, create a permanent and generous system of paid sick leave for all Americans. This would let people take time off when sick, reducing the exposure of others to illnesses, and thus boosting productivity overall. Finally, provide better unemployment benefits and higher pay for most Americans, since spending is what drives every other part of the economy. Things like welfare, unemployment, and Social Security are not charity. They are literally what keep our economy from collapse during a downturn. If people can't spend money, the whole engine grinds to a halt, and that's where we're going to find ourselves in coming months. And as the damage unfolds from the way this is being handled, remember that it was all avoidable if we had simply obeyed the lessons of history and maintained sensible policies. That, of course, is one reason I'm in this race, but that's another matter. And I'll shut up for now so we can get to your questions.
So we have a bunch of really great questions for all of you. I'm going to start with one that we just received from Carol G. She wants to know about essential workers. So she says that we have a class of workers right now who have been deemed essential. Those who are critical to our infrastructure, including childcare, pre-K. We're talking about people who work in our grocery stores. Of course, the wonderful doctors, nurses, and all of the staff who help at our hospitals, our janitors, people who are holding us together. So these people do not have the ability to simply stay home, stay safe, and they work because they need to work, right? So what can we do to support them better? What can we introduce to not have them this position in the future and keep them more safe?
I can begin with that one. You hear me?
Absolutely.
Great. Thank you. And thanks for the question, Carol. I agree. Our essential workers are so underpaid, are unprotected. We don't even provide the necessary PPE and other necessary equipment, including for grocery workers and delivery workers, to maintain their health. It's one of the reasons I was discussing that California needs to have mandatory paid sick leave for all workers with benefits, and we need to look at all workers being able to receive benefits that may involve increasing our union representation, certainly for, say, industries such as grocery workers, restaurant workers, etc. It comes back down to how workers' rights have deteriorated over the past 40 years, with wages actually taking a downturn while cost of living has steadily increased and escalated. And we need to reverse this. We need to address this. We need to devote a good portion of our political wherewithal to addressing workers' rights and workers' needs. I hope I answered some of that question for you.
Absolutely. So who else would like to contribute? This is a critical area. I would like to throw in a note while we're switching in that SEIU 2015 is working on a campaign right now because their workers in the hospitals simply do not have enough PPE, and their negotiating efforts to try to get that PPE to their workers it's not getting as far as they would like to. So we all need to support their ability to have PPE to continue to do their jobs. Liz, I see you're ready.
Yeah, I was just going to say I agree with Kate, and we definitely should be looking at, hazard pay for our essential workers who are out there risking their lives, and ensuring, like Liam was saying before, that people have paid time off for if they're sick or they need to stay at home to care for a child. Because right now, we don't want people who are feeling ill working at our grocery stores or in our hospitals, but that's the reality they have to face because they have to pay their bills and they're not able to collect unemployment because they're essential right now. So we need to make sure that our workers, are healthy, financially and physically healthy too, to help us get through this. So yeah, I definitely agree. And then living wage all around. I mean, not just now, but after the pandemic's over and we're out again and, the economy's, back on track, we all deserve a living wage. Like the cost of living, Kate, you're right. I mean, it keeps going up and up and up. I mean, a 2-bedroom apartment for $1,800 making less than $15 an hour or $15 an hour, it's impossible. And then add to that, if you have children, everybody deserves to be able to live, and that's something that we definitely need to look at as a state, if not a nation, depending on how the Senate goes and the presidency goes. But at least let's protect California.
If I could add a short, I guess, kvetch to that, because it's kind of a personal pet peeve of mine that everyone's talking about our essential workers and running all these cute commercials talking about, thanks to our essential workers here. And I'm like, can you please just give them a living wage and good working conditions and the equipment they need? I mean, we don't need fluffy schmaltzy commercials. We need workers actually cared for. So yeah, raising wages to match the cost of living. Hello.
Liz, I just wanted to make the comment that I'm an essential worker and I am able to collect unemployment. So if you are unable to return to work right now because of COVID-19 and being at risk, you are able under COVID-19 to file for unemployment. So, and it does require one's doctor just signing off that you are at a higher risk level.
All right, so our next question comes from Nathan. He says that Newsom makes half measures like having restaurants cover meals for seniors, but in the Coachella Valley, undocumented families do not qualify for stimulus checks. They don't qualify for a number of these different programs. How can he help, and how can we help to make sure that undocumented families and a number of other classifications, like people who are married to people who don't have a social security number, can be included in some of these policies that are supposed to get the economy going? Liam.
Yeah, I could pitch in on that. I think sadly, if you're asking what can we do, it's going to have to be us pitching in, working with charities, helping out the unions who are doing this, helping out the nonprofits who are specifically trying to help the undocumented population, because we're not going to be able to count on many resources coming in from government for this. It's a political hot potato in any state, including California, and it's difficult in DC because of, Republicans. But realistically, what we need to do is get past this whole idea of undocumented and solve the immigration problem. It was artificially created in the first place. The undocumented population used to be really tiny until Republicans changed the way things worked. You know, if we can just get back to the way our immigration system used to work, we wouldn't have this problem at all. But that's going to be difficult to get through. We honestly just have to replace a lot of Republicans.
Others? Liz.
Yeah, I was just going to say with, Newsom putting out a package for undocumented workers, but 2 days ago there was a lawsuit filed, to stop us from spending that money on our undocumented residents. So, I mean, as far as the government goes, Liam, you're right. Like, our hands are tied. We'll be stuck in lawsuits, going forward, but we need to be able to implement laws that, speak to this long term. To make sure that there are things put in place to protect all of our population, not just some of our population. And Nathan, just so you know, if you look in the chat, there's a little link that I have to a Google Doc that has different resources for undocumented people, undocumented families, by some of it's general and some of it's by classification of work. Like there's certain, things for bartenders or certain things for farm workers. So you take a look at that document and it's being updated daily as new things progress. So,
yeah. Kate, do you have something? Otherwise, I've got one other thing I wanted to kind of throw in. Just to connect back to a point that I'd made earlier, it's like Republicans want to pretend that the massive undocumented population they created in this country has no impact on our economy. If you have 11 million people who suddenly cannot spend because they've lost their work and they're losing their houses, it's going to cost us a ton of money. It's going to push the economy as a whole down. These are people who do work in the U.S. Regardless of whether you think they should, they are. And their financial situation affects all of us.
Okay, so I have a question from Catherine. Catherine asks, how come California has not implemented a form of universal health care yet? I know we've been working on it for quite a while, but give us some background.
So SB 562 was up last session, or maybe the session before, it all blends together, but I was working with CNA to educate the public about SB 562 and also went to Sacramento to lobby for it and spoke to the Appropriations Committee. Anthony Rendon, and sorry Anthony if you're watching this, he's a Democrat, but I'm not a fan of his. He actually shelved the bill, SB 562, and stopped us from being able to proceed with it going through the committees. There were some flaws in the bill, don't get me wrong, but there were amendments that were written that were supposed to be attached to the bill to fix those, which they never got attached because the bill was shelved. We need to elect, I don't care if you're Democrat, MPP, Republican, it doesn't matter, but we need to elect people who are going to fight for universal, Medicare for all of California. The way it's looking right now, it doesn't matter who gets elected, Biden or Trump. Either one of them is not going to pass Medicare for all. Joe Biden actually said he would veto it, even if it was passed. So California needs to stand up for themselves, and make sure that our state is healthy. So we're gonna, we just need to focus on, volunteering for those candidates who will push for it, financially, if you can donate to candidates, who want it. Maria Estrada, who is running against Anthony Rendon, would be amazing if we could get her elected, because then he wouldn't be there and he wouldn't be a problem. So, we just really focus on the candidates who will push this forward, because that's what we need. We need to push it through all the committees. CNA has, some great bills written, and we need to find people who are willing to work, with the nurses and the healthcare providers to, find the best solution, and get Medicare for all.
Let me just add to that, Liz, that I also am very much in favor of Medicare for all and universal health care, as I mentioned. My understanding, the rationale that was given by Speaker Rendon at the time was that they didn't believe that they would be able to obtain the federal backing in order to make the universal health care SB 562 a reality. I'm not saying that's right or wrong or taking sides. I'm just providing information that they were concerned that it wasn't the right time with the current administration, and that if it failed, that it might be more difficult to push again. However, I also plan to go to Sacramento, and I'm very passionate about healthcare for all Californians and all Americans. And that's actually the reason why I'm running for Assembly District 75, being a healthcare provider. That is my primary goal, is to get healthcare for all of us.
If I could add something there, it's a little difficult too, because I'm used to dealing in a lot of gray areas and giving multiple answers to things, but politics likes to have a nice, simple answer. The truth is, if we were to replace enough people in Congress to actually push through a good healthcare bill, whoever's in the White House is likely to sign it. You just need to have the numbers for it. If you can get overwhelming support for that, Joe Biden would sign it. True, he's been tied to a lot of the existing healthcare system. He's not a fan of it, but it's just, it falls on us to force his hand. If Democrats demand it, then a Democratic president has to go along with that, regardless of how opposed he might personally be to it. So just, again, both sides of that.
Absolutely. We can disagree or we can agree on the subject, but the fact of the matter is a Democratic administration is going to be leagues better than anything this president is going to do for us. I mean, one who respects children and who respects families and who values our lives is going to be leagues better. I have a question specifically for Dr. Amaro, so don't go away, from Indrajit. This question is, the tax bill passed by the Trump administration hurt California by eliminating SALT. What can you do, or what would you do to address the situation?
The entire Republican approach to tax makes no sense. So if I had my choice, I'd tear the whole thing down and put it back the way it used to work, where we gave actual incentives for growing the economy here and helping American workers, and actually tax the people who are benefiting the most from the way the system works. If you tax somebody who's making millions and millions and millions every year at a high level, they're still going to be rich. But it helps to provide a basis for everyone else to grow up. Instead, the bottom 50% have literally lost $1 trillion in wealth in the last 20 years. We are going down while they're going up. Trump's tax bill absolutely contributes to that, and it shifts some of the problem onto states that historically have done relatively well and historically also contribute more to the federal budget than they get back to the state. States like California do contribute more. We are a large enough economy that we're paying in and we're basically subsidizing Mitch McConnell's state. So yeah, but it's not just his. It's George W. Bush's tax cuts. It's Reagan's tax cuts. We need to go back and revise the tax code and make it work for most Americans.
So the last question we have for today goes to Jessica, but it is a big one. Jessica asks, can for-profit hospitals or healthcare companies be fined and or penalized for their failure to follow protocols, things like providing PPE, and also for not keeping any emergency stockpiles? Universal Healthcare Services owns a lot of our hospitals in California, and the CEO took home $23 million last year. We're hearing about nurses demanding and begging for PPE, but no one's talking as much about holding these private companies, private for-profit companies accountable.
Yeah. Can I start with that? Okay.
Absolutely.
Firstly, yes, I'm gravely concerned about the loss of our community hospitals, our public hospitals throughout the state and throughout the nation. Over the past 20 years, we have lost incredible numbers of local community public hospitals whose primary focus really was the public health of the community. They were nonprofits. And yes, we do see that under administrations in recent decades, more and more of our public hospitals have been lost to us, our community hospitals have been lost, and instead we're seeing these for-profits, just as we do in the insurance industry. Had this pandemic occurred, however, prior to 2011, the state of California would have been in a much better position to handle this crisis because we had emergency stockpiles at that time. And in fact, when they defunded our emergency preparedness program in Sacramento, all of those stockpiles were either sold or given away, or simply are no longer useful because of deterioration in the materials. And we also had an entire army of these mobile hospitals that would have been ready to be delivered to whichever communities were in need of them, and could be created and built within hours to days. So we were actually quite well prepared. And we do have to remember that it's the Department of Public Health, our DPH in California, at the national level, of course, our CDC, which is supposed to back up our DPH, that is responsible for monitoring, managing our emergency preparedness supplies and stockpiles, as well as conducting the necessary research on a global level about any potential pandemics that are coming, etc. And because both at the national and state level, our emergency preparedness programs were all defunded and wiped out, that's what led to this unpreparedness. Do the for-profit hospitals help in any way? No, that's why I was recommending in my talk, again, that we have a public system that is going to be much more responsive and interactive with DPH and CDC and ready for emergencies, because it's going to be a single system instead of all these for-profit hospitals, you know. And frankly, we would all wish that we could believe that public health was their number one priority, but a for-profit hospital or insurance plan is for profit, and that is their number one priority.
I see Liz.
No, I was just going to add that, you know, if we head back to 1970s when healthcare wasn't, you know, allowed to be profited off of, you know, somebody's sickness, there was a lot better healthcare, and the costs were a lot lower too. So I would like, you know, Liam, you know, to look at possibly, you know, seeing if we could take away the Health Maintenance Organization Act of 1973, you know, and bring back the not-for-profit, you know, healthcare system, you know, because that's, you know, that's where people were able to actually access healthcare. I mean, a lot of us have health insurance. Well, not a lot of us anymore because we're out of jobs, but anyway, but a lot of us had healthcare, you know, some type of health insurance, but we didn't actually have healthcare. You know, I have health insurance, but I can't afford my copays or deductibles to actually go to the doctor. So I don't go to the doctor. I don't go for wellness visits. I don't go when I'm sick. I just don't go. My youngest son, in the middle of the night, like just probably like 2 weeks before COVID hit, you know, he had like extreme pains and like in the night, and we thought, oh my gosh, it's his appendix. Like it's got to be. So we went to the emergency room. We were there. We were there for a really long time. We were actually being seen for less than an hour. And then they were, you know, they said, oh, we don't actually, there's no way for us to tell if kids actually have it or not. You know, that's Children's Hospital. That's not here. We don't do that here. And we went home and I just got a bill in the mail for $2,300 after the insurance, which is a PPO, covered their portion. We're still left with, or actually maybe it was like, I think it's close to $3,000 is what we owe on that. So, you know, having health insurance is not what we need. We need health care. So yeah, Liam, if you could work on that, that would be great.
Yeah, and bringing up the distinction between the two of them, I think is very important because honestly, and poll after poll shows this, a lot of Americans don't really understand that. You tell people, say, I love my health insurance that I get, but what they're thinking of is their provider. They're thinking of the doctor they go to, the hospital they go to, not the bean counters making money off of that. So helping people to understand that there's a difference between the insurance and the actual care providers, right? That's, I think, vital to doing this. And realistically, I mean, I like to make a parallel back to an argument that was made from the right during the argument over the ACA, right? Trying to get that passed. You had like Sarah Palin screaming about death panels and, you know, do you want them to decide if grandma can live? And what was astonishing to me about that was that is exactly what we have and have had for decades, because A corporation's job is to make a profit for shareholders. That's it. That's literally their purpose for existing. So if a corporate insurance company is running your healthcare, they're going to decide what treatment they actually approve for you and who literally lives or dies. Those decisions are already being made every single day all across this country. And the fact that people are not upset about that, and I don't know, it's always blown my mind. So I think making a better distinction between insurance and care, I think will really help in getting that argument across. So thank you, Liz.
Mm-hmm. I agree. And, I'm particularly interested in often the objection when people are fearful of going to universal health care and losing their private health insurance. They're concerns about having adequate choice. That's often the argument. And I have to educate them on the lack of choice that they currently have, which is what you were just speaking to, Liam. Over the years, we've seen copays rise from, originally they were typically $5, to now I see many patients whose copays are $50 to $60, and that might be on top of a deductible that can be up to $6,000 annually, plus they're paying monthly premiums for their health insurance. Then when they finally have an illness and they need care, they realize, oh, I really don't have a lot of choice here. As you're saying, these choices are made for me, and they're not made for you by your provider, by the way. They are made for you by the insurance company. I've worked on both sides to see what it's really like. I kind of got in there for a couple months with an insurance company to see who was making the decisions, and it is not your providers at all. In addition, the whole issue of public versus private, I like to use the example that I have an urgent care just literally 2 minutes down the street from me. If I need an urgent care, however, I'm required to go to my particular medical group, unless I want to pay out of pocket, which means I have to get on the 15 and travel 25 minutes south to get to my medical group urgent care when there's one right down the street from me. What type of sense does that make? It just saves the for-profit insurance company money, so they want to keep the services within their system and by their providers, but it doesn't serve our healthcare or our public health at all.
So now we're going to wrap up. So what I'm going to do is I'm going to give each of you just a minute or two to share any thoughts that you have that you'd like to round out the discussion with, and then we'll wrap up. And I'm going to start with Liz.
I am unmuted. Yay. Yeah, so I mean, I guess this, switched from like the economy into healthcare, which is all, everything's all interconnected anyway. But we will be having a town hall specifically on healthcare and Medicare for all coming up too. So definitely tune in for that. If it's, if you're concerned about unemployment or have any questions about it, just remember that the hotline is open from 8 to 8 now, 7 days a week, not just the 5 days. And if you're still having difficulties with that, by all means, you can reach out to me. You can email me at liz@elizabethlavertu.com. You can call me on my cell phone at 619-807-6947. My team and I have been making calls to seniors in the area, and a lot of seniors are still employed, because they can't retire at 65 anymore because financially it's just not possible for a lot of people. And so most of like their concerns, if it isn't like they can't get food, it's that they couldn't figure out how to do the unemployment thing online or how to access it. So honestly, if you have any questions, I've walked through it with so many people now. I'm not an expert at it, but I can literally, I've memorized every single page that you'd be on and what questions you might have. So just please reach out, because we definitely need to make sure that we have some source of income during these times to be able to survive. So I'm here for you, and thank you.
Next, we'll go to Liam, and then the last word will belong to Kate.
Okay, so I'll echo Liz, having pointed out that we will come back to the issue of healthcare again. We're going to be focusing a lot of these virtual town halls early on issues that connect to the pandemic and our response to it. And then we'll start going more into our broader issues as we go along with this regular issue, and healthcare is going to come up rather a lot in that because it's important to all three of us. And I will definitely make the point, I'll let you know right now, when we're talking about things like Medicare, I'm going to talk a lot about the way we frame the issues, because Republicans get away with a lot that they shouldn't. I mean, like, it takes away your freedom. No, it increases your freedom, because the only thing that should be making healthcare decisions is you and your provider, not some bean counter trying to make a profit off of your illness.
Right.
If you can go anywhere, if you can go to the closest or the person you like the most to make the decisions that make the most sense for you, it increases your freedom. Insurance, again, not healthcare. We'll come back to that a lot, and I'll talk about that kind of stuff when we get to it. But just again, so Liam O'Mara, running for Congress. I'm pretty easy to find on social media, my website, anything like that. Please follow me, say hello, join the team. Thanks very much.
Kate.
Okay, got myself unmuted. Well, thank you all for joining us. I really look forward to these weekly discussions and deep dives into the topics, particularly how COVID-19 has been impacting all of us in our communities. And yes, Liz and I both, and well, Liam as well, because you were just at a food bank helping out this morning, I understand, Liam. So, but we've all been devoting much of our energies currently to volunteering and helping out in our communities, ensuring that our community members are aware of the resources they need, have access to them, and we work with them on problem solving. We maintain an up-to-date daily resource list on the Fallbrook Regional Health District website, and I play a large role in that. So you can go to our website for updates. Also, I'm sure to Liz's Facebook page, to my Facebook page, Kate for Assembly District 75, and my website, kateforassembly2020.com. Please speak to everyone you know about the importance of voting. Please, that we can see during a crisis such as this, just how important it is, who we have in leadership positions, and what types of options we have due to that. So regardless of which party you belong to, it really becomes irrelevant when it comes to needing affordable health care or housing, a good paying job, adequate wildfire protections, climate change, and upgrades in our transportation systems, among other issues. So we hope you will speak to everyone you know. We are really working toward positive change in November, and we appreciate you being here and your support. Thank you so much.
We hope you all have really enjoyed the depth and the breadth of experience that we have in our panelists and the information we'll be able to discuss. We will be talking about universal health care next week. We'll get really in the weeds, bring all of your questions, bring all of the insight that you would like to have into the process and into the history of it. We really want to make sure that you can actually get the information that you want, and you can advocate for it, and then we can keep going. I do want to end on one short note. As someone who was, during the Schwartz administration, a public employee, I had the experience of being a furloughed employee, having that payment taken out, having to deal with that, the shortcuts, and our governor was not with us. I mean, today you've heard about all of these different programs that our governor has worked to put into place, that he's refining, all of this just back and forth to try to help some of these different groups. So the partnership that you have in office is critical. If you look at these great candidates we have, these are partners in office who take your ideas and then take them to our capitals and help get them into action. So from having lived the experience of one governor who did not value our people to another governor who is trying, can definitely use more allies in office. We let you know the importance of voting. I just want to echo Kate, because that is critical. That's what's going to get it done. And that's something that we can all do, each and every one of us, to make sure that we can get the changes that we need. With that, we're just going to go ahead and thank you and ask you all to be safe, to stay well, to wear your masks, and to enjoy the rest of your evenings. Thank you.